Good day everyone. We are the group 1 and today we will be discussing about principles and theories in teaching and learning. So, there are lots of theories about learning and how learning takes place. Like we learn something from our parents or whenever we go to school and learn something in class from our lesson. Each theory has their own view on these different aspects of learning. So, we're going to talk about three today, and that is behaviorist, cognitive, and social. First, behaviorist learning theory. It focusing mainly on what is directly observable, currently in educational and clinical psychology. So, behaviorist theory is to modify people's attitude and responses. Behaviors either alter the stimulus conditions in the environment or change what happens after a response occurs. Respondent conditioning is also known as classical conditioning. According to Ivan Pavlov, classical conditioning is two stimuli are linked together to produce a new learned response in a person or animal. So for example, he showed the dog some food and rang the bell at the same time. After a while, the dog would associate the bell with the food. They would have learned that when they heard the bell, they will get fed. Eventually, just ringing the bell made the dog salivate. So that is our laway po. They learn to expect food at the sound of the bell. So you see, under normal condition, the sight and smell of food causes a dog to salivate. Food will be the unconditioned stimulus, and the salivation will be the unconditioned response. As humans, we never trained our dog to salivate over some food. However, when we pair unconditioned stimulus like the food with something that is preciously neutral like the sound of the bell, the neutral stimulus becomes the conditioned stimulus, and so classical conditioning was discovered. That is how it works with animals, and let's see how it works with humans. In healthcare practice, for example, someone without much experience with the hospital, that is NS, the neutral stimulus, may visit a relative who is ill. While in the relative's room, the visitor may smell offensive odors and feel queasy and lightheaded. After this initial visit and later repeated visits, the hospital now is the conditioned stimulus. So this is the several pairings. So because of the offensive odors, that is UCS and UCS is unconditioned stimulus, because of that, queasy feeling is the unconditioned response. Because hospital and offensive odors is paired, the response for that is the queasy feelings. And we can see here, this is the several pairings. The hospital now become the conditioned stimulus and the queasy feeling is the conditioned response.
Now let's discuss operant conditioning. Operant conditioning focuses on the behavior of the organism and the reinforcement that occurs after the response. A reinforcer is a stimulus or event applied after a response that strengthens the probability that the response will be performed again. When specific responses are reinforced in a proper schedule, behaviors can be either increased or decreased. Operant conditioning is, if the reinforcement is set, the response may have been increased or decreased depending on the method that they use. So the main goal here is to have an increased behavior of the operant of the responder. Now to fully understand this, let's look at the method that they use in operant conditioning. The two methods to increase the probability of response are to apply positive or negative reinforcement. According to Skinner in 1974, giving positive reinforcement greatly enhances the likelihood that a response will be repeated in similar circumstances. It is giving something unpleasant to someone or to the client. So a second way to increase a behavior is by applying negative reinforcement after a response is made. So it is removing something unpleasant. Now to fully understand this, let's have this for an example. It is in a nursing or nurse's perspective. A child patient doesn't want to drink the medicine. Positive reinforcement that a nurse can do is to give the patient a token or a treat for the child to drink the medicine. The nurse gives something unpleasant to the patient, and it is the token or the treat. Now, On the other side, negative reinforcement is that the nurse can do is to give the child a tasteless medicine instead of the bitter one. So the nurse remove something unpleasant, and this is the bitter taste of the medicine. These methods can increase the child's behavior. We does not promote punishment because most probably it can only result to decrease of behavior, since the main goal here is to increase responders' behavior. For operant conditioning to be effective, it is necessary to assess which kind of reinforcement are likely to increase or decrease behaviors for each individual. Not every client, for example, find health practitioners' term of endearment rewarding. Comments such as "very nice job, dear" may be presumptuous or offensive to some clients. Operant conditioning techniques provide relatively quick and effective way to change behavior. Carefully planned programs using behavior modification procedures can readily be applied to healthcare. Nurses should be observant and not to assume that the method you use to one patient can also be applicable to all. It is best to plan program on how you reinforce method that increases responders' behavior, and you can use the positive or negative reinforcement that is used in operant conditioning.
So, we're going to continue our discussion on operant conditioning by looking at escape and avoidance learning. Escape and avoidance learning is a form of negative reinforcement where the individual is going to perform a behavior in order to stop a negative stimulus. So, again, this is a reinforcement, so we're increasing or strengthening of behavior, and since this is negative, we are removing something. Now, escape and avoidance learning sound similar, but they are different from each other. In escape learning, you are going to distance yourself an ongoing stimulus. In this case, there is nothing that is telling you that the stimulus is coming. It has already happened. Example, you can have a rodent in a two-compartment box. So here's the picture to have you an idea what is rodent. So the rodent can move from one compartment to the other compartment. In this case, the rodent is going to be given a foot chalk in whichever compartment it's currently located in. And what it has to learn is that it has to move to the other compartment to terminate the foot shocks. In this case, it is escaping the negative stimulus. So, in avoidance learning is when the animal performs a behavior that it prevents a forthcoming negative stimulus. So that means the negative stimulus has not been delivered yet. So, we'll use a similar case where you have a rodent in a two-compartment box. Here, a conditioned stimulus in the form of light is going to be delivered. So, there can be flash of light, and when there's a flash of light, the rodent must move from its current compartment to the other compartment to avoid the foot shock. So, here the light signal serves as a warning signal. Once that warning signal is delivered, the rodent has to learn that if it doesn't move to the other compartment, it's going to get a foot shock. So again, you can see the difference between escape and avoidance learning. Escape learning is escaping from an ongoing stimulus, whereas avoidance learning is performing a behavior to prevent a negative stimulus from.
Active learning theory, and this is the topic was assigned to us. What is cognitive learning theory? Cognitive learning theory illustrates a notion. Anyway, notion is the same synonymous word of belief or concept that although behaviorists often disregard the internal dynamics of learning, cognitive learning theorists emphasize the relevance of what goes on the learner's mind. Cognitive learning theorists have sub-theories. This includes Gestalt, information processing, human development, social constructivism, and social cognition theory. This perspective emphasizes a particular feature of cognition. Collectively, when pieced together, they indicate much about what goes on inside the learner. Gestalt perspective. This is one of the sub-theories, and it talks about configuration or pattern organization of cognitive elements, reflecting the maxim that, and I quote, the whole is greater than the sum of its part. Information processing. This is one of the sub-theories. It talks about cognitive approach that stresses thinking processes such as cognition, reasoning, information encounter and storage, and memory functioning. Cagney, 1985, and Stenberg, 2006. It is important for nurses to understand how knowledge is integrated and retrieved, particularly when it comes to older people's learning. Heumann and Kirk, 2005, and Kessels, 2000. In information processing, there are stages. The first stage in the memory process involves paying attention to environmental stimuli. Attention then is the key to learning. In the second stage, the information is processed by the senses. The third stage of the memory processing, the information is transformed and incorporated or encoded briefly into short-term memory, after which it suffers one of the two fates. The information is disregarded and forgotten, or it is stored in a long-term memory. The stages of information processing, and this is the last stage in the memory processing model, involves the action or response that individual undertakes on the basis of how information was processed and stored. In general, cognitive psychologists note that memory processing and the retrieval of information are enhanced by organizing the information and making it meaningful. Descriptive model has been provided by Robert Kidney. Kidney and his colleagues outlined 9 events under corresponding cognitive processes that activate effective learning. Kidney, Briggs, and Wagner, 1992. These are the ways, or rather, gain the learner's attention. Information inform the learner of the objectives and expectation.
Information processing viewpoint is especially useful for analyzing issues with collecting, retaining, and recalling information. So among the strategies are the following. First, have learners indicate how they believe they learn, or the metacognition. Second, ask them to describe what they are thinking as they are learning. Third, evaluate learners' mistakes. 4. Give close attention to learners' inability to remember or demonstrate. So, for example, forgetting or having difficulty in retrieving information from long-term memory is a major stumbling block in learning. So, memory processing and functioning is highly pertinent to healthcare practice. So, whether in developing health education brochures, engaging in one-to-one patient education, delivering a staff development workshop, preparing community health lectures, or studying for courses and examination. In addition, for strategies, focusing on attention, storage, and memory is essential in the patient education of older adults, including the identification of the fatigue, medications, and anxieties that may interfere with learning and remembering. By Kessel's cognitive development is a third perspective on learning that focuses on qualitative changes in perceiving, thinking, and reasoning as individuals grow and mature. So, it is based on how external events are conceptualized, organized, and represented within each person's mental framework or schema, which in turn is partially dependent on the individual's stage of development in perception, reasoning, and readiness to learn. For now, I will then discuss the non-cognitive development theories, Jean Piaget. So, he is the most well-known cognitive developmental theorist. His studies of children's senses and thinking processes at various ages have greatly aided our understanding of the unique, evolving capacities of children to reason, comprehend, communicate, and perform. So, at the same time, identified and described four sequential stages of cognitive development: the sensory motor, pre-operational, concrete operations, and formal operations. Next is Lev Vygotsky. So Leo, a Russian psychologist, emphasized the significance of language, social interaction, and adult guidance in the learning process. So when teaching children, Vygotsky says that the job of adults is to interpret, respond, and give meaning to children's action. So he advocates clear, well-designed instruction that is carefully structured to advance each person's thinking and learning. For now, we will continue to discuss the cognitive developmental theories about learning. First, despite the fact that cognitive stages progress in a logical order, some individuals never reach the formal operations level. Second, adult developmental psychologists and gerontologists have hypothesized advanced levels of adult thinking that expand beyond formal process. So, for example, individuals do not get better at dealing with paradox, synthesizing knowledge, and successfully integrating what they have learned until they reach adulthood. Third, older persons may exhibit advanced levels of reasoning as a consequence of their knowledge and life experiences, or they may exhibit lower levels of reasoning as a result of a lack of education, sickness, depression, extreme stress, or trauma.
In relation to the other topics, we are going to talk about the cognitive developmental theories about learning. So first, despite the fact that the cognitive stages progress in a logical order, some individuals never reach the formal operations level. So what is this formal operations level? This is for an individual to formulate hypotheses and systematically test them to arrive at an answer to a problem. The individual in the formal stage is also able to think abstractly and to understand the form or structure of a mathematical problem. So second, adult developmental psychologists and gerontologists have hypothesized advanced levels of adult thinking that extend beyond formal processes. For example, individuals do not get better at dealing with paradoxes, synthesizing knowledge, and successfully integrating what they have learned until they reach adulthood. In this, we can say that some individuals do not use what they have learned throughout the years of experiencing and learning new knowledge that may help them in the future. So the third is older persons may exhibit advanced levels of reasoning as a consequence of their knowledge and life experiences, or they may exhibit lower levels of reasoning as a result of a lack of education, sickness, depression, extreme stress, or drugs, according to Huiman and Kiyak in 2005. So in this topic, we can say that not all older people are smarter than younger people who have a proper education about a certain topic. So not all older people may be right. So next topic is social constructivism and social cognition. These are two increasingly popular perspectives within the cognitive theory that take the social milieu into account. So, social constructivists. Social constructivists takes issue with some of the highly rational assumptions of the information processing view and building on the work of John Dewey, Jean Piaget, and Lev Vygotsky, according to Polinskar in 1998. These theorists posit that individuals formulate or construct their own versions of reality, and that learning and human development are richly colored by social and cultural contexts in which people find themselves. Social cognition perspective reflects a constructivist orientation and highlights the influence of social factors on perception, thought, and motivation. When applied to learning, it emphasizes the need for instructors to consider the dynamics of the social environment and groups on both interpersonal and intrapersonal behavior. As an illustration, attribution theory focuses on the cause and effect relationships and the way in which the world operates. Many of these explanations are unique to the individual and extend to be strongly colored by cultural values and beliefs. So, the advantages of cognitive learning theory is that nursing and other health professional education programs would benefit from demonstrating and encouraging empathy and emotional intelligence in their interactions with patients, families, and staff, as well as attending to the dynamics of self regulation in order to promote positive personal growth and effective leadership. Second, recognition and appreciation of variety and variation in how individuals learn and process events. Third is it emphasizes the vast range of differences in how learners actively frame their views, face a learning scenario, encode, process, store, and retrieve information and control their emotion, all of which are influenced by social and cultural factors.
Good morning, ma'am, and good morning to my fellow classmates. Our next topic is all about social learning theory in healthcare. So, what is social learning theory in healthcare? So, let me explain. Social learning theory, also called observational learning, it is a method to observe and watching other people and determining what happens to them, also to observe a behavior, attitude, or emotional. To map out a perspective on learning that includes consideration of the personal characteristics of the learner, behavioral pattern, and the environment. As the model has evolved, the learner has become viewed as a central pole human agency. It is suggests the need to identify what learners are perceiving and how they are interpreting and responding to social situation, such as careful consideration need to be given to the health environment as a social situation. Learning is often a social process, and other individual, especially significant other, providing compelling example as a role model like how to think, feel, and act. The dynamic of social learning, role modeling, vicarious reinforcement, self-system, self-regulation. Role modeling is a central concept of the social learning theory. It is a more experienced nurses who demonstrate desirable professional attitude and behaviors that sometimes serves as a mentor for less experienced nurses. Vicarious reinforcement is another concept or term from social learning theory and involve viewing other people. Self-system, through health professional and take a system approach to improve health quality. It have the four states of system approach as identification, description, alteration, and implementation that could be used to model components of healthcare to bring unified thinking to address areas where gaps may toward optimizing patient care. Self-regulation is a learning that considered one of the key capabilities being essential for the health system. It works to cope successfully with the current challenges they are facing. Therefore, healthcare curricula are increasingly called upon to support self-regulation as a central learning outcome.
The second part of the social learning theory is the elements of observational. Albert Bandura, the psychologist who developed social learning theory, provides a useful framework for the cognitive processes or elements that enable role modeling learning. These are the attention, retention, reproduction, and motivation. Let us first tackle about attention. Attention means the mental focus or concentration and the willingness to observe and mimic the behavior model. It's crucial to create a safe environment where students can practice and reproduce modeled behaviors without fear of being judged or condemned. So, first of all, it is important to make them pay attention in the start of the process. When learners have different levels of knowledge and ability, such as in hospital rounds, group settings can be difficult. So, instructors make sure to create an environment where the concepts are challenged but not the learning. A teacher, by example, must create a culture of curiosity and camaraderie in order to model professionalism, respect, and enthusiasm. Next is the retention. It means to encode the behavior in the memory or the ability to store information. To be able to reproduce what they see, a person must remember and recall what they see. To pay attention and retain information, a person must be physically and mentally involved because engagement and re engagement in healthcare must occur at all levels and among all participants. And the main goal of the retention is not for them to remember and reproduce everything they see, but rather to assist them in determining what is important and what should become part of their professional skills. So, next is the reproduction. Reproduction means to actually perform the behavior observed because in order to evaluate learning from being attentive and retaining information, the students must execute what they have learned. The instructors must provide students with a platform to practice what they are learning by paying attention to and remembering what the teacher is doing. As learners gain confidence and competence in their own demonstrated abilities, reproduction seamlessly transitions into motivation. So, what is motivation? Motivation or reinforcements, learning through social interaction can be a powerful motivator for students, and it is the force that drives one to act. People want to learn in that style, and that style makes people want to learn because most of us want to be commended and recognized by the things that we did. By that, we become inspired and more eager to learn. There are three forms of motivation or reinforcements. First is the direct reinforcements. It occurs when the individual watches a model to perform, imitates the behavior, and is reinforcement or punished by some individual. So when you engage in a specific behavior and are rewarded, it is a positive reinforcement. Or if it results in the removal or avoidance of something unfavorable, it is called negative reinforcement. Next is the vicarious reinforcement. It is it means it is the observe anticipates receiving a award a reward for behaving in a given way because someone else has been so rewarded. Or, in simple words, a person learns by observing the consequences of another person's actions. Let's say, for example, when a younger sister sees her older sister being rewarded for a specific behavior, she is more likely to repeat that behavior herself. Next is the next and the last one is the self efficacy, or self reinforcements. So, the, in- the individual strives to meet personal standard and does not depend on or care about the reaction of others. It is more likely knowing your worth, trusting yourself, and your ability to do accomplished tasks. So, to sum up everything that has been discussed, people need to see what they want to reflect. They need to mentally and physically rehearse what they see in order to retain it. They need the opportunity to take what they see and rehearse in order to reproduce it. And lastly, they need reinforcement as an incentive or motivation to keep on doing it.